Hello everyone, my name is Dr. Wisdom. Welcome to Kingdom Sites. Today I'm going to be teaching on case history. What is case history? Case history is a planned professional conversation between the doctor and the patient. It enables the patient express himself and let the doctor know why he came for a visit. It is important to note that case history begins immediately the patient walks in, and then the patient is the most important person in the case history. So he's treated as a VIP, he's treated with care, honor, and respect. Also, you should note that the case history should be done in a confidential setting. Why this is so that the patient is relaxed and trusts that whatever he says will not be seen in the public. It is the most important aspect of the exam and helps to streamline whatever the doctor is doing. You also need to know that the case history is open-ended, so it gives the patient opportunity to express himself. It's not a question and fire session. It is a session whereby the patient is allowed to express himself effectively. What are the benefits of the case history? The first benefit of the case history is that it improves the patient compliance. The patient is able to comply better. Secondly, it reduces the patient's complaint. Thirdly, it helps to streamline the diagnostic test. It reduces the time wasted, it saves the patient's time, and also saves the doctor's time. So after we've known this, the doctor begins by introducing himself. He says, I am Dr. So. Once the patient knows that he's talking to a doctor, he is relaxed and knows that he's in safe hands, knowing that he's talking to a trained and licensed professional. Having known this, now let's look at the components of a case history. There are about 11 components, and I'm going to walk you through all of them so that you understand them and know what to do in each component. The first component of the case history is what I call the chief complaint. So the first component is the chief complaint. So this simply means that this is the patient's complaint. The patient tells you why he's there, and the doctor writes it in a simple and in a way that it can be understood by all. Even that when it's not around, the next doctor coming can understand what we mean by chief complaint. And then there are tips to guide you in chief complaint. We have an acronym called folder Q, which is FOLDAR and Q. F stands for frequency. For instance, the patient walks in and tells you that, Doctor, I'm having headache. You ask, what is the frequency of this headache? How often does it happen? The second one you need to ask is the onset. Onset means, when did this headache start? Did it start yesterday? Did it start last week? Or did it start this morning? Also, you look at the location. L stands for location. Location of the headache. Is it temporal? Is it superior? Is it occipital? So this will give you a guide on what to do next. Then you look at duration. For how long has this headache been happening? What is the duration? It gives you an instance into the patient's threshold level. And also, we look at associated factors. A stands for associated factors. Does the headache come with pain? Does it come with double vision? Does it come with symptoms? So we want to know what are the associated factors associated with this headache. And then R means relief. Relief simply means, are there things the patient does that helps to relieve it, or has he used anything to relieve this headache? It gives you an insight and gives you a proper treatment plan. And then finally, we look at the quality. What is the quality? Ask the patient from a grade of 1 to 10, what is the quality of this headache? Is it 1 to 3? You know it's mild. Is it 4 to 6? You know it's moderate. Is it 7 to 10? You know it's severe. And it helps you to understand the chief complaint. Remember I said earlier that the chief complaint must be simplified and in simple terms. Now, the next component of your case history is what we call the patient ocular history. So number 2 is the patient's ocular history. The patient ocular history involves, 1, you ask the patient, does he wear glasses? And for how long has he been wearing glasses? Patient's ocular history, in brackets. So you find out, is the patient wearing glasses? And for how long? Has he been diagnosed of glaucoma before? If yes, you write glaucoma. Has he been diagnosed of cataract before? So you want to, the patient ocular history, you want to have an idea of what has happened to the eye before. Has there been a case of trauma? Has there been a case whereby he went blind for some minutes? You want to have an idea of all this. So this is what you want to achieve in your patient ocular history. The third component is what we call the patient's medical history. So here we are trying to find out the patient medical history. We are asking questions such as, is there history of hypertension? Is the patient hypertensive? If yes, we ask, are you on medication? If the patient is not on medication, we write not on medication. The next one is diabetes. Does he have diabetes? If yes, we indicate. If no, we indicate. So assuming the patient says, yes, I have diabetes, we write yes. Are you treating it? He says, I'm treating it. You write on medication. You also ask the patient, are you asthmatic? Is there history of ulcer? So these are the questions you can ask. You can also ask for women, you can ask, is there arthritis? And then also give room for any other disease you feel you've not mentioned here. You can ask the patient, is there another disease I've not mentioned here? So that he lets you know. It could be tuberculosis, it could be any other disease. You ask them and then they tell you. And also for children, we want to find out how they were born. Were they born through cesarean section or were they born through direct means? So we want to know, it gives us a clue on what's going on in the eyes. So the fourth component of the case history is what we call the family ocular history. So we want to find out, is there history of glaucoma in the family? Is there history of cataract in the family? Is there history of strabismus in the family? Is there history of blindness in the family? We want to know all this and document it properly. So you ask the history of glaucoma, cataract, strabismus, blindness, and cause of blindness. And then if anybody wears glasses in the family. This is the component of the patient's family ocular history. The fifth component is the family medical history. The fifth component is family medical history. So here we want to find out what's going on in the family. Is there history of hypertension in the family? Is there history of diabetes in the family? Is there history of asthma in the family? Is there history of ulcer in the family? So the doctor asks the patient and expects a feedback. So you ask for hypertension, and then you ask who has hypertension. Is it the mother or the father or the siblings? And if they're on medication for it. So you write on medication, that is if they're on medication. We're also looking at asthma, diabetes, ulcer, arthritis, and any other sickness which runs in the family. The doctor wants to know about this. Allergy. So we want to find out if the patient has any allergies. We want to know, is it seasonal or does it come or does it happen all the time? The doctor wants to know the allergies of the patient. The patient's drug history. So the doctor wants to also know what the patient is taking. For instance, if the patient says, I am on Xalatan, it is the duty of the doctor to ask, this Xalatan, how are you taking it? The patient might tell, I'm taking it twice daily. It is now your duty to correct and say, no, Xalatan should be done once at night. So you ask, what drug are you taking, the name, and then the duration, or how often the patient is taking it, and find out also if the patient is consistent with this drug medication. After drug history, we want to also find out the social history. The social history. This involves the patient's occupation. We want to know what the patient does for a living so that it will give an idea of his daily visual demands. Also, want to know the patient's hobby. What does he enjoy doing? Does he smoke? Does he drink? Whatever he does, we want to have an idea of it. Remember, it's always a confidential setting. So whatever the patient says, you rest assured that it's in safe hands. And then number 9, we look at last eye examination. The last eye examination. We want to know when last the patient visited the clinic. For instance, patients who have glaucoma ought to visit the clinic regularly. So if the patient has glaucoma and is telling you that the last time he came to the clinic was 4 or 5 years ago, it gives you an idea, knowing that likely the patient has stopped using his medication, and then you know what to do with that. And then number 10 is what we call any other complaints. Any other complaint. So you ask the patient, apart from what I have listed above, apart from what we said before, is there any other thing worthy of note that we've not said that ought to be said? It gives you the patient room to also say other things. They might not be relevant to you, but they are relevant to him. And then after all this, the doctor summarizes whatever the patient has said to the patient. Now, this shows that the doctor is listening. It shows that the doctor has the patient at heart, and it shows that the doctor is in charge. So thank you all for listening. So this is just an overview on case history. Remember, this is Kingdom Sight. Don't forget to like, subscribe, comment. If you have any question, please comment on the comment section and share the videos to your loved ones. God bless you.